Hi everyone, it's Dr. Crad. In this video, I will talk about and show you a video of a refractive lens exchange with the Clearview 3 lens implant. Refractive lens exchange, or RLE for short, is a procedure performed to help reduce or eliminate the need for glasses. It's most commonly performed for patients between the ages of 45 and 65 prior to the onset of visually significant cataracts, but after the onset of presbyopia, since it's past the ideal time to undergo laser refractive surgery, such as LASIK, PRK, or SMILE. The ideal candidate for refractive lens exchange depends on their glasses to see both far and near. If someone can already see perfectly far away and only needs glasses for near, you need to think twice before proceeding. Your near vision should improve significantly, but there's a possibility that your far vision is of slightly less quality. During refractive lens exchange, the eye's natural lens is replaced with a lens implant. This lens implant is designed to last for the remainder of the patient's life. And since the natural lens is removed, patients undergoing refractive lens exchange don't move on to develop cataracts later in life. Lens implants are available with varying characteristics. Some provide maximum range of vision, allowing a patient to see far, near, and in between without glasses. Others provide maximum quality vision, allowing the patient to see extremely well far away, day and night, but they are more likely to depend on reading glasses for near vision. Vision without glasses can be very good with a max range lens implant, allowing a patient to be mostly or completely independent from glasses. No lens implant is perfect, however, and so patients with a max range lens may notice imperfections in their vision, such as glare at night or ghosting or shadowing when reading fine print. This is because current max range lens implants are simultaneously focusing far, intermediate, and near objects in your view. Over time, the majority of patients see very well because the brain adapts to the new visual system. We call this neuroadaptation. This process can take many months. From the current max range lens implants available in the United States, one of my favorites is the Clearview 3 lens by LensTech. This lens provides a broad range of vision with a relatively favorable nighttime vision profile, allowing patients to even drive at night comfortably. That's because this lens implant does not have rings on it like other multifocal lenses. In my experience, this lens has a very high satisfaction rate. It provides the vision clarity of a multifocal lens, but a higher tolerability similar to that of extended depth of focus lenses, or EDOF lenses for short. With the Clearview, some patients may describe an asymmetric flare emanating from car headlights, but the majority of patients tell me that it's subtle and over time they don't seem to notice it. No lens is perfect, and not everyone is a candidate for the Clearview. The company does not manufacture a toric version that neutralizes astigmatism, and there is a limited power range available, meaning that if someone has a very short or very long eyeball, it may not be available in their size. Also, the Clearview is not ideal for patients with tiny pupils. If a patient really wants to get the Clearview, but they have significant astigmatism, a second procedure would be needed to reduce their astigmatism in order for the patient to see well without glasses. Because this is a lens implant that's a multifocal, it does split light, and I would take the same precautions with this lens as with any other multifocal lenses. For example, if a patient has macular degeneration or any other significant macula problem, I would consider avoiding this lens. If a patient desires freedom from glasses, their pupil is of normal size, their retina is healthy, and they have low astigmatism, and this lens implant comes in their size, then the chance of the patient being happy is extremely high. In this video, I removed the patient's natural lens. I polish and power wash the posterior capsule thoroughly. I polish the anterior capsule as well. And now I'm preparing to implant the Clearview 3 lens. There's a hole cut out from the haptic on the side of the lens with the reading segment. 50% of the light in this lens implant is dedicated to far vision, and 42% is dedicated to near vision, and there's a transition zone in between. There are many ways to orient the optic of the lens implant. For example, you can put the near segment infranasally close to the patient's nose like they did in the FDA trial, but surgeons around the world have had success positioning the lens in various ways. Personally, when I started implanting the Clearview, I would position the far segment infranasally. I did that at first because I just felt it centered better, and the patient was happy, and so I just continued to do that. I had one patient where the lens implant rotated 90 degrees. This was during the postoperative period, and the vision was still excellent. So I think there are many ways to position this lens depending on the patient's anatomy, but you do want to center it. You want to make sure that light energy, when it goes through the pupil, some of the energy goes through the near segment, some goes through the far segment. For surgeons just getting started with the Clearview, I recommend removing the viscoelastic before rotating the lens. And the reason for that is because it's a little bit difficult to rotate the lens when it's swimming in viscoelastic. The lens is trying to rotate through thick sludge. Once you remove the viscoelastic, the lens implant rotates extremely easily. Oftentimes, on day 1 after surgery, patients will be seeing 20/20 far away and J1 plus near. But I've also seen many patients have excellent far vision and poor near vision on day 1, only to come back a week later and their near vision is much better. So I wouldn't be discouraged if the patient cannot read well on day 1. Give it a week. See how they're doing after 1 week. After I remove all the viscoelastic, I'm sealing my main incision, and then I'm going to rotate the lens through my paracentesis. I want to position, in this case, the far segment infranasally. So I'm going to rotate this clockwise a little bit. So I'm using my BSS cannula to rotate it clockwise a little bit. I'm making sure my incisions are watertight and that the eye pressure is appropriate. And then I'm going to have the patient fixate on the microscope lights. I recommend centering the lights slightly biased on the distant segment. It could be center or pericentral right on the far segment. Sometimes I'll take the red reflex light, that's the narrow slit light, and I'll turn it off and on to make sure that the patient is paying attention and looking where they need to. So you'll see the light go off and on repeatedly. In future videos, I will be sharing patient feedback with the lens. I will interview them and ask them about the quality of their vision. I really appreciate your attention. Thank you so much for watching. I'll catch you on the next one. Peace.